A shocking photo has emerged showing bodies lying abandoned on stretchers next to living patients in a Hong Kong hospital as COVID deaths spiral in the city fueled by a low vaccine uptake. A medic working at the hospital told Hong Kong Free Press the photo was taken inside the accident and emergency ward of Queen Elizabeth Hospital in Hong Kong and circulated on Friday. The photo, reportedly taken in early March, showed 6 body bags lying on stretchers as bed-bound patients struggled to prop themselves up. Body bags lay right beside the surviving patients with tags labeling their contents, a grim omen for those still relying on ventilators for breathing support. Chinese officials are struggling to contain the biggest COVID-19 outbreak since the pandemic erupted in Wuhan 2 years ago. Health authorities reported 29,381 new infections and 196 deaths on Friday. The hospital authority understands that sometimes bodies cannot be transferred to the mortuary in time, said Sarah Ho, chief manager of the hospital authority said on Friday, adding that the situation appearing in the photograph has since been dealt with. We hope everyone could be understanding about how public hospitals have done the best to use more manpower to handle this situation. We are very sorry for causing discomfort to patients, she said. Hong Kong's hospitals are being overwhelmed, with the South China Morning Post reporting the city now has the world's highest COVID-19 death rate per capita. The news came as China prepares to send another city into lockdown, cutting off over 9 million people inside Chongqing. China reported another 397 cases of local transmission nationwide on Friday, 98 of them in the Jilin province where the city of Chongqing is located. Hong Kong leader Carrie Lam said on Friday that the city's COVID-19 vaccination program would focus on its elderly and children, as authorities battled to reduce a surge of coronavirus infections and climbing death rates. In total since early 2020, the global financial hub has recorded almost 650,000 COVID-19 infections and about 3,500 deaths, most of them in the past 2 weeks. Hong Kong registered the most deaths per million people globally in the week to March 9, according to Our World in data. Most have been unvaccinated senior citizens. Until this year, the Chinese-ruled city had an enviable track record of controlling the virus due to stringent measures as part of its zero-COVID approach, which like mainland China seeks to eradicate outbreaks at all costs. However, many residents in the former British colony chose to remain unvaccinated for most of 2021, due to the minimal number of infections and fear of side effects, particularly among the elderly. Over 90% of the deaths were those who had not been fully vaccinated. We need to catch up and vaccinate every Hong Kong citizen, Lam told a daily news briefing on how her government was managing the virus. While there has been a rapid pickup in vaccinations, more than 90% of the population have now had at least one dose. Rates among the more vulnerable elderly have lagged the rapid spread of the Omicron variant in the city. just over 53% of those over 80 are vaccinated, government data shows. Lam said her government was shifting its approach to target the elderly with more medical resources after a senior Chinese official said Hong Kong needed to prioritize reducing deaths. The government had previously focused on identifying, treating and isolating each infection even if they were mild or asymptomatic cases. It was also planning to hold a mass testing scheme for the city's 7.4 million residents in March. Lam this week said there was no time frame for the testing and it would only be done if there were sufficient resources. Hospitals, morgues and isolation centers are overflowing, while some supermarkets and grocery stores still have empty shelves nearly 2 weeks after residents began stocking up in anticipation of a potential citywide lockdown. Many residents have been frustrated about what they see as constant changes in the government's policy. Lam said she was the authoritative source for all coronavirus information and would address any rumors or misinformation. Her administration was managing the outbreak as best as possible with the changes aiming to achieve the objectives of safety and health, she said.